Hello, Patricia. Oops, watch out, watch fingers. Just- Good afternoon. It is Wednesday, July 19th at 4:30 p.m. and we're going to start the regular meeting of the Dubuque County Health Department. I'm sorry, the Dubuque County Board of Health at this time. I'll begin with roll call. Patricia Lemkuhl. Here. Adam Hoffman. Here. Hendrik Schultz.
Here.
Sandra Larson. Here. Jeff Smith. Mike Fidgen.
Here.
And Amy Crow-Sunleaf has already notified us that she needed to be late today, but she does plan on coming. Okay, so we do have a quorum present, and so we will proceed now with public comments. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand if you're on Zoom or in the room here. And when you're called upon, state your name and home address. Individual remarks are limited to 3 minutes. These are, you may speak now on matters which are on the agenda. Would anyone like to speak tonight? Seeing none, then we will go on to number 3 on the agenda, chairperson announcements and updates. And I have this congratulations to Allie. I know she doesn't want me to bring this up, but I wanted to bring it up because I'm so proud of her. She was in the newspaper, and recognized as, a good healthcare worker in our community. And she was their nurse, Turpin Dodge of Dubuque's Nurse of the Week, a couple weeks ago. So congratulations, Allie. It's well deserved. Let's see. I don't think I really have any other announcements at this time. Just, I would like to thank all of the board members who have been putting in extra time on some of our special projects, and we really appreciate that. Next on the agenda, our Board of Supervisor, Board of Health Liaison comments by Ann McDonough. Ann?
Yes, thank you. Good evening. I appreciate, as Sandra indicated, the extra work the board's doing on the subcommittee level. I have attended a few of the opioid meetings, and I think we are beginning to see a framework there, and I appreciate that very much. I would like to note, I guess, congratulations to you, Allie. I missed it in the paper, but that's great that you're recognized for your outstanding work as well. And then I just wanted to comment, if I could, on a couple things. The 988 decals to Dubuque County vehicles. I'd be interested to hear an update on that. I did raise that discussion to Samantha Berglund, who is our coordinator for the brain health region, our Dubuque County department head for that department here. And also I visited with some of my colleagues, other supervisors from other counties, about whether the region should be doing this or paying for this. So kudos to this Board of Health and Allie for beginning this work about 988 decals, because it may be beyond Dubuque County. It might be region wide, and we are part of the most populous region. So if that is something that that's a great way to make something be bigger than what we're doing here. So I appreciate all that. I also just want to note that I have been following the correspondence back and forth with the county attorney, and would like to be helpful any way I can. I think that having legal counsel to get questions answered is important. This is when you do ordinances and you're impacting on individuals' rights to how they use their property. That's very emotional and also can be legally charged as well. So it's important to feel like you have confidence that you're going about things in a way that you feel confident that the department has direction. So please let me know what I can do to be helpful there. Maybe it's discussion that needs to happen with Board of Supervisors. But Allie, I will follow your lead, and Sandra, you and I've kind of chatted a bit too. So thank you for allowing me to be here this evening.
Thank you for being here. Next on the agenda is the approval for the agenda for July 19th. And I have one modification. Under action items number 8, we're just going to change the order, or I move that we change the order. And letter A, Dubuque County Public Health Department name and logo revision will become E, and E, septic variance request 8676 Kane Road, Dubuque, Iowa, will become A, so that we can hear that just a little bit sooner, so that Mr. Coates, who's here to speak on that, can leave. So I move that we make that modification. Is there a second to that motion?
I second that.
Thank you. Is there any discussion? Hearing none, all those in favor of the agenda with the modification say aye.
Aye.
Thank you. All those opposed? Hearing no opposition, then with that modification, the agenda is approved. Number 7 on the agenda is presentation and reports. And first we will have a health department monthly report by our director, Allie White. I would like to do the approval of the minutes. Thank you. Sure. We have the minutes for June 21st, 2023 attached. Is there a motion to approve those minutes? Is there a second?
Second.
It's been moved and seconded that the minutes be approved. Is there any discussion? Hearing none, all those in favor of approving the minutes for June 21st, 2023 say aye.
Aye.
All those opposed? Hearing no opposition, the minutes are approved. Now we'll have the report by our director, Allie White.
Thank you, Sandra. I too would echo all of the thanks that I've heard in this room, especially to the Board of Health. I know that a lot of the work that you've been doing is above and beyond what would normally be asked of a Board of Health. So very much appreciate all of the support on a personal and a professional level. I do have my Board of Health report. I'm not able to share my screen. I apologize, but it's part of the packet, page 8 of 53 for anyone who'd like to follow along. Following the kind of standard that I've done in past reports, I'll talk briefly about the tasks that have been completed by our department, current and ongoing projects, and then just touch briefly on the future plans for our department. For those of you who have the report in front of you, you'll see on the left-hand side, I'd like to propose an update to both our logo and potentially our name. The top one that you see there is the logo that the Dubuque County Health Department currently uses. And the bottom is what I would like to change to. That is the Universal Public Health logo. And you'll see above, I reference that if this logo is used consistently and over time, it just kind of raises awareness and the value of governmental public health. It is universal. You'll see some local public health departments use it, but not all. But I would request that we consider that. And then currently, I think we call ourselves the Dubuque County Health Department. I think it would be beneficial for us to be formally known as the Dubuque County Public Health Department. So just a couple of recommendations that I have there. Completed tasks, there are 4 main things that have kind of wrapped up. I did participate in an immigration forum that was presented by the Community Foundation of Greater Dubuque. A lot of good information, and there were some real key takeaways about how we can support individuals who were not born and raised in our community. They sometimes have differing health needs or differing access to healthcare. Second, you'll recall that the CDC was in our area recently, completing examinations of selected residents. They wrapped up their examinations on July 3rd, and their results are pending. I've requested data through them that are specific to the testing that they had done. Specifically, I was curious to know how many individuals were invited to participate in the examination, and of those, how many did participate. Bullet 3 there, the public health preparedness update, the COVID-19 after action report, and its corresponding improvement plan were facilitated by Emergency Preparedness Consulting, and those are now complete. They are part of this packet, and we can discuss that a little bit further in just a moment. Finally, under completed tasks, you'll notice that there was an alignment town hall meeting that was held in Waverly. I referenced at our last meeting that the Iowa Department of Health and Human Services is exploring ways in which to try to make more efficient the delivery of local public health services to Iowans. They did reference that there will be a survey coming out that they would like residents to complete. I have not yet received it, though if and when I do, I will pass that along. Ongoing projects. Our strategic planning is still underway. We're currently in phase 2 of 4. And during that time, our planners are performing individual virtual interviews. And again, those are all of the individuals that were present at our kickoff meeting should be receiving an invitation, as well as other community representatives, including areas from brain health, equity, youth, environmental health, food insecurity. Put that mic in. Thank you. Long-term care facilities, and then especially hearing from our rural healthcare providers and federally supported health centers. And finally, our elected officials. So lots of interviews taking place. We just wanted to make sure that any area that our health department can interact with or should be interacting with is included in this planning process. Second bullet there under current and ongoing projects, the community health assessment draft number 1 is not complete. It is in progress. I had hoped to have it completed by this point, but we do have a good start. The next phase of the process will include engaging community members. So we're going to create focus groups around the 3 top priority needs that we identified, which you'll see here. 1 is mental health and substance misuse. 2 is access to dental care in our community. And the 3rd was physical activity, nutrition, and obesity. So the steering committee will be reaching out to community members kind of specific to those areas. So then we can create a corresponding improvement plan. The opioid settlement fund subcommittee did meet yesterday. And so I would like to further define the role of a new health department staff member. I've been holding off until this point to make sure I had a good grasp on what we needed in our department. I finally just started writing down different tasks that I needed help with, and then worked with one of our local public health consultants, regional consultants, and said, these are the tasks I have. Is there a title that you think might fit this? So I have a proposal for the board tonight for that. And then also we continue to coordinate with the VNA, and I know one of the things that we were looking to do was to update the branding. So like when we're out at the fair or whatever, we can have the Dubuque County Public Health logo on any of the promotional items that are there. So, and then future plans. I had been meeting in the different communities every Friday. Unfortunately, it's fallen by the wayside along with the quarterly newsletter, simply because there just aren't enough hours in the day, but those I do anticipate to resume, not over permanently, just temporarily. Second bullet under future plans, we did note that the recent air quality concerns prompted public health intervention or at least public health notice. And there were a number of people who were interested in receiving N95 masks. So what I noticed was that perhaps rather than having them here at our department, we could distribute them to city clerks so that our residents maybe wouldn't have to travel so far, or would have easier access to those supplies. So we're currently reaching out to city clerks because we probably will have more air quality concerns in the future. And in an effort to continue to collaborate and form partnerships, I will be visiting Crescent Community Health Center in early August. AED maintenance, I just wanted to make a brief note. I noticed that there are AEDs stationed around the county buildings.
AED?
It's an automated external defibrillator, thank you. So if someone were to cardiac arrest, it's a device that could be used until emergency help arrives. They only work if they're serviced regularly and make sure that their batteries are working and that the pads and things are not expired. So I noticed ours needs some work. I can only imagine that others around the county do as well. So I'll be working with other department heads to make sure we get a plan in place for that. And finally, I had one more bullet to add. We did have an opioid subcommittee meeting yesterday, and one of the things that was mentioned was that it may be helpful to have access on the Dubuque County Health Department website for opioid data and resources. So I will continue to work to update our webpage to include that.
Thank you, Ally. And speaking for myself, and the rest of the board can pipe up if they'd like to, but if you need to temporarily pause things, you have my full support, and I think you probably have the board's support. So if you need to temporarily pause things, don't worry about it. It's fine. We understand the staffing situation and the workload situation, so.
I appreciate that.
Our next item, does anyone else have anything that you'd like to
I
add?
just had one question. So then you're proposing then that this logo replaces whatever this is up in the letter. What is that?
I think it's just one that was
The
created.
county. I think it's
If
the
you-
county.
Yeah,
Is it?
if you zoom in, it is kind of small, but that gray area that's right by the D in Dubuque County, that's the Dubuque County logo.
Oh, okay.
And that would be replaced by
That'd be
this one.
replaced by the public. Okay.
Mhm.
Okay, thank you.
Just to
Anybody-
clarify, you cannot, it says that you cannot alter this in any way. There was a way in which I thought that maybe combining the two, but unfortunately, that's not allowable.
Okay. All right, the next item on the agenda is COVID-19 after action report.
Yeah, so I think this has kind of been a long time coming. The entire report is included in the packet, so I will spare all the detail and just touch on the main points. So, Emergency Preparedness Consulting LLC, is an Iowa firm, and they were hired to complete this assessment as a third party, following the pandemic. So the report addresses the time frame between the first diagnosis of COVID in the US, which would have been February, March of 2020. And then the report itself did conclude in November 1st of 2022. So important to note that there was an end date on that. And the purpose of an after action report is to identify strengths and weaknesses of a entity's response to a pandemic. So best practices were identified as a result of this and lessons learned. It's a report that I would say we are proud of, and if using correctly, is only going to strengthen our response to future pandemics. I will note, I think one of the important things to note in this is that Dubuque really took a unified approach, something that not all areas did. Dubuque formed what they called the Incident Management Team, or the IMT, and it included representatives from the Dubuque County Health Department, the City of Dubuque Health Department, the Dubuque Visiting Nurse Association, or VNA, and Dubuque County Emergency Preparedness, in addition to our neighboring county, Clayton County Public Health. So this group formed because what they, at the time, it wasn't me at the time, did not want to happen was that all these different entities were sending different messages, right? So if they met regularly, they could ensure that they were all sending out the same message. And I can speak kind of on the other part of that because I worked for the school district during that time as the health services coordinator and relied heavily on the support and guidance of this team. So I don't have enough positive things to say about it. But basically this formation of the IMT then created a streamlined and efficient process for which to respond. If you look at page 13 of the report itself, or page 21 of the packet, it talks about the primary strengths and the primary challenges that were identified. The strengths, I think, were, again, the unified approach, outreach. So many of the stakeholders, myself included at that time, felt that the predictability of correspondence with the IMT was helpful. You knew you were going to meet with them every week. You knew which information you were going to receive. And it was reliable, dependable, and focused. Another strength that was identified as a result of this was the documentation that was put out. So guidance documents like posters and that sort of things, calendars about when you need to isolate that outline days 0 through 5, those types of things that were relevant and easily understood. Another strength was that the IMT did target specific populations that were difficult to reach. So messages that were sometimes reaching the general public, but not always reaching those special populations. This team took it upon themselves to make sure that everyone was reached. And then the final strength that is outlined here is that community stakeholders advised that although K-12 schools were receiving information from multiple sources, the IMT was key in synthesizing those things. So I can speak on behalf of sometimes the Iowa, what am I trying to say? Public health was saying one thing and then the schools were saying another, and it was, thank you. Yes, the Department of Education was offering others. So it was sometimes difficult to know how those pieces fit together. And it was the IMT team that really helped to walk us through that. And then, as there should be, there were some challenges that were identified. And they have 5 bullets listed here. One was that there wasn't always a clear process for operationalizing activities to meet the goal. So an area for improvement would be to streamline that process or make it publicly known. Also to make sure that all stakeholders know what the concept of an IMT team is, so that everyone understands why it was formed and the messages that are being sent out. They noted that the city of Dubuque had a great public information infrastructure that had already been in place. And because of that, some of the stakeholders felt that there was a disconnect between the communication for the needs of the city and those of the county. I think that means, to me, that means an area for improvement would be to leverage public information outreach, either as a county or as a department. The 4th one there was, let's see. There were several layers of legal, political, and procedural challenges that at times prevented the work from being done efficiently. So I think with knowing roles and responsibilities is important. And then the last one talked about opening a shelter, which really, I think the challenge of it was that the shelter was open much longer than anybody had ever planned for in any sort of emergency operation plan. So important to note that this IMT team will continue to meet, right? And that we will formulate an improvement plan and probably also update our emergency response plan as a county.
Correct, and I would just add a big part of that, that I think this summarized it. We kind of knew as we were going through some of the information, the feedback we received, we knew in advance that there were areas that even we noted the gaps. And I think it's just important for us to see that and be able to figure out how can we do it better? You know, what do we need to have in place to prevent this going forward? And a lot of this isn't just isolated to us locally. I think it was worldwide, unfortunately, but I think it's a good report. I think it captured a lot of feedback, and that's important because it's going to help us move forward. And so us, like other counties in Iowa, did the same thing and are doing the after action reports, and public health across the state will learn from all of it, and then we'll continue to get better. Thank you.
Thank you. Ally, what was the 3rd one? You're going to update the emergency response plan?
Is that what?
Under the challenges?
It wasn't listed as a challenge. I was saying that the IMT would update its local emergency response plan as a result of this finding.
Yeah, a lot of it had not been updated in a while, or we found that COVID lasted a lot longer than we thought, and by the end of 2 to 3 years, none of that information was valid anymore, or people left positions, and making sure that's key to having all of that information updated routinely makes things go a lot faster and a lot smoother. The right people will get the right information where it wasn't always the case.
Will this be formally presented to the Board of Supervisors, or is this the end of it?
I had not considered that. I would be happy to if that's something that.
Supervisor McDonough, do you think this after action report, would the supervisors appreciate that being formally presented, or?
Yes, I think it should be during a work session so that the supervisors are informed. I would just note that since this time that the report was being done, for the first time in 20 years, all of the supervisors have actually received emergency training. That is not something that was being done. So we had elected officials that didn't understand chain of command. It's embarrassing. It's absolutely embarrassing that we were, literally caught flat foot like that. But I think the supervisors would appreciate receiving this report, and it doesn't need to be a long work session, but Ally, the update you just gave would be helpful to us, and also might be a vehicle to get that information out to the mayors. I don't know if this is the time again to thank Dr. Hendrik Schultz. We only had a face mask mandate in Dubuque County because Dr. Schultz went above and beyond what any private citizen would do. He wasn't even on the Board of Health at that time, and he met with mayors individually after hours. And Hendrik, again, my eternal gratitude to you that you made that happen. So whenever I think of the pandemic response, I think of the father of the response to be Dr. Schultz. So
No, thanks for your kind word. And I think you're giving me way too much credit. This is a great team that did it. And we all did not have any playbook. So let's put it that way. I'm glad it's over. I think we have other things we need to focus on now.
Correct. A couple of things that I noted in the report. I didn't see the Board of Health mentioned very much, but it was mentioned on page 17, and it's observation 2.05, Board of Health engagement. And it says there was a disconnect in projecting information throughout the county because there was not a strong message from the County Board of Health. The IMT relied on other networks, etc. So, lesson to us, you know.
And I think, I mean, as somebody who, I mean, Stacy and I lived in the middle of it, I think that's very true. There really wasn't a voice from the Board of Health.
Yeah.
And so we took it from the city. I mean, it just, the voice wasn't there.
Well, I think we're all dedicated to make sure that the voice of public health is heard. So the current board, I think, would want to improve upon that. And then on page 16, observation 1.09, continuity of operations planning. And it says this is something that our department is in charge of. Let's see. The Dubuque County Public Health Continuity of Operations Plan was created in June 2008 and appears to have been updated in April 2020. Continuity of observations is an effort to ensure that essential functions continue to be performed throughout or resumed rapidly after a disruption of normal activities. A best practice is to review and update such plans following an incident that requires the plan's activation so that lessons learned from the real world incident can be incorporated into the plan. So that might be something we have to look into. So I just wanted to make a note of that.
I started.
Okay. All right. Well, thank you to both of you that were on the committee that followed up with this after action report. So I appreciate it. We appreciate it. All right. Anything else, Ally, on that? Okay. Any questions for Ally? Next, we have the VNA monthly report from Stacy Killian.
So I wanted to actually tag on what Ally had talked about with the Health and Human Services assessment and alignment. There's been a lot of emails that have gone out and a lot of information across the state. One of the things that came out, I believe today, is that they are going to open up some more virtual sessions for stakeholders and community members that want to listen in. I know we've received a lot of feedback at the VNA, and I know Ally has here too from different groups throughout the community that are watching this assessment and this potential alignment and how it will impact the services. The reason they're looking at this is looking at how with the alignment of DHS and public health and how every county serves patients a little bit different, especially some of those vulnerable patients, such as our Medicaid population, things like that. They're taking a look at all the different programs that they oversee and how are services being delivered across the state. How can we align it better and do better in serving patients? So it's a very big issue that will affect the health department. It will affect the VNA, especially Hillcrest, another one that would affect anyone who serves populations, especially those that are currently enrolled in different Medicaid programs, things like that. Anytime you work within a program within Iowa Department of Public Health or DHS, it's going to be impacted. And so some of them that are impacted are tobacco, which is a grant that is held through the Board of Health. family planning, maternal and child health, I Smile, environmental health, local public health, services, WIC, DCAT, CPPC, family development. I mean, there's a ton of programs that really are going to be impacted. This early childhood is another one that will be impacted.
Aging too.
Yeah, area agencies on aging and yeah, so there's a lot of how mental health services are delivered regionally. And so if you get an opportunity to attend one of these town halls, I think it's a great chance for you to listen in at the information that is being shared and provide your feedback. I will be the next step. So the timeline is they're doing a documentation review in June. In July, they started town halls and now they're going to move into stakeholder interviews. I'm actually going to be interviewed as VNA's connection with many of these programs, family planning with, we've asked to be interviewed as a stakeholder. So on the 25th, I'll be interviewed on behalf of public health and child health. So I'm glad to have that opportunity to have a small group interview with this health management company and kind of speak on behalf of public health and all the needs that we see here locally. But they will do those stakeholder interviews and then they'll move to synthesizing the information, identifying different options and recommendations, delivering the final results in October. And so my understanding is they will take a look at 2 different methods of delivering these services throughout the state and aligning them better county to county. And so this could really truly impact everything we do and how we do it, especially with public health. So something I would just encourage everybody to kind of keep an eye out for, watch if you get the chance, participate on behalf of what we do here and what our needs are locally. So I know Allie's been great at trying to participate any chance she can get. I certainly am doing the same thing. So
Is there, I mean, can other people be involved? Can I call them up? Can I talk to them?
you know, I think I don't know how formal this will be. I do know that through the town halls, you can definitely speak. I know Allie, and we just talked about Allie had given the opportunity to provide some feedback. And I do know in the end, at least 2 proposed service delivery options with at least 2 proposed funding models will be offered.
So they didn't give you a hint about what those 2 would be, right?
Nope. No, and I can tell you just from experience through the VNA, I do know that a lot of it is very different. It's like when you look at emergency preparedness, we're regionalized in a certain way. It's very different than some of our other programs, which have service delivery areas that don't match anything like emergency preparedness. So I have no idea which way this will go. I do hope that it will be in the best interest of all the patients that we do serve, and it's something that will work on a local level. I'm along with everybody else, I think has concerns on, you know, how do you, when you match this, does it work in a rural area as well as an urban area? And, you know, if it works here, does it really necessarily work on the other side of the state very well? And I'm glad to see they're doing their due diligence and getting input from stakeholders and community members and residents. I hope over the next few months, a lot of people have an opportunity to really talk in that. So just wanted to add that in there. Also, Alan Lynch, who is our TB program manager at Health and Human Services, he was in Dubuque last week, the week of the 10th, and he was meeting with providers to discuss incorporating routine TB screening and testing into primary care visits, mostly looking at identifying the difference between TB and pneumonia. So he did meet with many providers at Crescent on 7/13. So I was lucky enough to bring our communicable disease nurse with and be able to sit in and listen to that presentation and some of that discussion. We've had a lot of increase in TB and in this area, particularly over the last couple of years. And so I do know that Pat was involved in some of that as well, and the hospitals were
This morning, and we're trying to get him outreach with some other providers in the community to speak to, because he's got a great message and it's something we all really need to be concerned about. So that's good information.
And he's been very hands-on with our here in Dubuque with any TB cases we've had or any services that we provide here. So
We have more TB cases in Dubuque than other cities, would you say?
no, he actually did give some really good slides, and I don't have them in front of me. I'm sure I could get them from, and I was surprised because I thought, especially since we did some particular testing here in our area that we had gone up higher than other communities, and it did not appear that we were much any higher than some of our larger communities, but definitely one is too many, so. But yeah, I'll see if I can get that information, because I think that would be great to share with all of you, and you can see across the state where how TV is kind of distributed. And but it's great that he spent so much time here. He was here, it's been here a little over a week now, so. Maternal health, we've been doing really good in our doula program. It's grown quite a bit. We are now administering doula services for Scott and Dubuque County, which is an expansion. We were just doing Dubuque. We have 35 slots and 27 of those already been filled. And we have 3 local community members that are working on becoming a certified doula, which is really great to have someone local do that. We were able to do some presentations to Cascade High School, Western Dubuque High School, and University of Dubuque to talk about contraceptive, family planning services, and maternal health in general. Our Child Health Advisory Council actually has been meeting pretty routinely. Both the maternal and child health councils are actually quite large. We've got a lot of good people joining our group, and tonight, actually, we are touring a new day clinic in Hillcrest. So I'm excited that that group was able to do that. And lastly, I wanted to just kind of give a little plug. So VNA is, I think I mentioned it once before, we are getting an e-medical record, which I'm so excited for, and it is epic, and we are going live August 14th. And so we are currently working on getting staff training, but we've already identified many of our programs that will benefit from this, not just with scheduling, but efficiencies within billing, data entry. It's going to have an impact on the workflow that we do have. It's going to save us a lot of funding. We are currently entering in everything manually, whether it's billing, whether it's scheduling, all of our documentation. And so there's a lot of human error there, which is a big concern. And so by having this, this EMR, it's going to make us a lot more efficient. Not to mention, we'll be able to talk better with other medical providers in the community, which is going to advance our referrals and things like that. So very, very excited that this is coming. And now that we're getting a little more trained, we're actually finding a lot more uses than what we thought. That's going to really impact the VNA. And so I think you have my other program. We're still continuing. Most of the grants ended June 30th, which is pretty standard, and restarted again July 1st. So we did get everything in here through June 30th in the program. We had several grants that a little bit of a concern that we ran out of money, that there just wasn't enough. Public health was one of them. And luckily we did have the county funding that was able to help supplement that. So no services stopped. But we've had quite a few of our BCC programs that went through their screenings, and we were able to get a good portion, if not all of that grant, pretty close to all of that grant being spent down. But other than that, I think BCC was the only one that didn't get spent fully, and that was just because of the way they bill and being able to get all those women through those processes. I think that's it.
All right, thank you, Stacy. Does anyone have any questions or comments for Stacy? Well, thank you very much for the report and all the hard work, Stacy.
Thank you.
We're going to move on to action items. I think tonight, this is going to be kind of a long, it could be a kind of a long meeting. So if anyone wants to take a break, just raise your hand and we'll adjourn for a few minutes. We have, I think, more action items on this agenda than we've ever had. So let's get started. We did move septic variance request 8676 Kane Road, Dubuque, Iowa to the first action item. So that will be the first thing that we're going to deal with tonight, board. We have Mr. Coates with us, Ken Coates, I believe. Ron Coates. Yeah. I knew it was 3 letters. Ron Coates is with us tonight. He is the landowner for the adjacent land, and it's all relatives, family members that own this particular land. Bailey's here. Bailey, do you want to explain this to us?
Yes. So Dana Rector, which I believe is Ron's niece, currently owns the home at 8676 Kane Road. And there is an existing septic system there, a soil absorption system, but it's not up to code. So they need to update the system, or replace the whole system, but there's not, sufficient area. So they would need a 10-foot variance, for the property line. So the septic system would initially be on the property line of the back of, so Ron Coates owns the property behind Dana's house. So they would need that 10-foot variance to be able to install a soil absorption system. And they did get a perk test done and it did pass. So,
Okay,
and everything, I mean, everything's still accessible and everything. It just, they would need that variance in order to proceed.
okay. Is this a small lot, I take it?
It's 1 acre.
1 acre lot? It's really too small to have a septic, I mean,
Well,
but the way
Well,
that they worked it out
you're in
here.
100 feet from the well. And all, you know, it's Ken and the people have been out there twice or a couple times. They did the perk test Monday and Tuesday, and like you said, it passed. And I don't have any problem with that leach bed that they're gonna put in, being close to my property, because the lot, this acre lot that my sister had forever, that the niece owns now, that acre went to my sister in 1964 for a wedding present. And we're trying to keep this whole area in the family. My son's gonna buy the home now from my niece. This farm and this lot has been in our name for 137 years. And we're trying to, I have no problem with this being against my property. It's the best route that Ken Beesing and his people came up with, so.
Okay,
Are you just to the south front? Did I hear that right?
What's that?
You're just to the south, like directly
Yeah,
behind? Okay.
correct,
Yeah.
yes, yeah.
Okay.
And that's been permanent pasture for generations, and it always will be permanent pasture.
That's nice.
Yeah.
Bailey, I just,
the prairie, it's a prairie. It's practically a
Yeah,
prairie,
yeah,
isn't
it's
it?
never been touched, yeah,
Never been plowed?
no,
Oh my
never.
goodness,
you research this, right?
yeah,
Bailey, I have a general question, like procedural stuff, because I know like you don't need a variance if you get like a mutual easement signed between property people. Like, do we ever, is that ever explored like prior to variance stuff? I just don't know procedurally how that works.
So will the septic system, Ron, will the septic system be on your property?
No, it'll be on the property with his homes. It will
So-
not be on my property. They needed 1,200 square feet, and Ken says they've got plenty.
But the way I read the code, Bailey, just, it says like that the 10-foot is the code unless a mutual easement is signed and recorded. So if they just do a mutual easement, we don't have to do anything, is my understanding of the code.
Yeah, so if you do a mutual easement, you will have to, you'll have to get an attorney to write it up and
Okay, so
then
that's, yeah,
it will need to be recorded.
okay.
But
so
I
that-
mean, if it was going to be any part of it or was going to be on Ron's property, it would for sure need a mutual
Right.
easement.
Yeah, okay. I just didn't know procedurally if that was something that was explored before. Like it came to us or stuff like this.
I've never personally heard of that, so it's
Yeah,
news to
I mean, that would
me,
be-
that
yeah,
would be
it's
something
easy,
that should be
But
explored.
in this case, I mean, I think in the family drainage into there is a big deal at
Yeah.
all. But I think in the future, that would be nice to explore prior. to
Yeah, if
coming
you
here.
can, the reason this is all important is what this body is doing is actually legislating when we grant variances. Because the legislature passed laws and said, this is how it's gonna be. And then people come into us and then we change it, you know, so we have to look at it very seriously. What the code tells us to do is, first of all, we have to get enough information so that the need for variance is substantiated. And then secondly, we will grant the easement, but we have to determine the propriety of such action. And so I asked our county attorney, what does that mean? What does the propriety of such action mean? And we didn't get an answer. So I don't know what it means, but I think it might mean we look at, is there an environmental concern if we grant this easement? Is there is it gonna look bad? Or is it going to impact on the neighbor? What are some other things that we should look at? I don't know.
Affect future sale, maybe?
Affect future sale, maybe, yeah. So, yes, Bailey?
So I think in this case, since the neighbor, well, Dana's uncle, Ron, his son's buying the property, so Ron will own the property behind him. I think in that case, since it's all family owned, I don't see a problem, and I don't see that it being a health issue.
But
And I think another thing, is there other options? And here with like small lots, I mean, yeah, like this is the best option for public health and for everything.
and if we don't grant it, it
Right.
makes the property unusable, I would assume,
Right.
unlivable.
Yeah.
Okay. So the county attorney said under this issue, some of the questions that we could ask is, what is the nature of the variance requested? What's the specific reason for the request? How long has the current septic system been there? Why are the setbacks now at issue? How was the septic system approved originally? And how big is the variation that they're asking for? Well, I think we kind of have all that information, and we're getting rid of the variance altogether in this case. But we're making a determination. I don't know. You don't think it's gonna cause a problem for anyone, is that?
Yeah, I think, I mean, and if we didn't, they would certainly just get an easement too. I mean, I don't think that would be an issue, other than it would be annoying to spend extra money and stuff like that.
Yeah.
But
Right.
since Ron's willing and that property owner is willing, they would certainly agree anyway, and that would waive the 10-foot.
And I know nobody's selling the property now, but it seems like for in the future, if you already had the easement in place, it would be helpful. Instead of trying to work it out with someone who's gonna buy the property, so. All right, so does anyone want to make a motion on this issue?
I move we approved the variation. Is that what we're not doing easement, right?
Okay.
I'll make a second.
Variance.
And Hendrik seconded it? Did you second? Yep.
Yep.
So we have a motion and a second to approve this request for a variance. Is there any further discussion? Hearing none, all those in favor of granting a variance to, what's the address? I'm sorry. Okay. Everyone who's in favor of granting that variance, say aye. Aye. Those opposed? Hearing no opposition, then the variance is granted. Thank you for coming, Mr. Cook.
Okay, thank you very much. I appreciate it.
Welcome. Now we will proceed with the agenda with item B, and that is adding 988 decals to all Dubuque County vehicles. Is there any news about that, or?
I believe at our last meeting, Amy had asked that we discuss that it be added as an action item to today's meeting to discuss or vote upon adding 988 to all county vehicles.
Well, I of course love the idea.
I wholeheartedly support it.
Do you have a motion?
I will move that we approve and stand probably behind 988 on all county vehicles.
There's a second? I second. Second. Any discussion?
Can
Just-
I ask
yes.
a clarifying question?
Yes.
Is this something that the Board of Health would make a request to the supervisors to add that to all county vehicles?
We're gonna have to get the money from somewhere.
Yeah, so I think we'd have to, yeah, they're the bosses.
Mhm. Okay.
So, it would, if we pass it, then we would have to take it to the board.
May I make a comment?
You may.
I do think we want to see if the region's going to do this. The region had several $1 million left at the end of the year. So I think Dubuque can be the originator of the idea, but I would like to not execute a check until we see whether or not the region's going to support this for all counties. We can put a time on that. You can say within 60 days or something so that you know that you're not waiting for years, but that'll be the position that I take as a supervisor when it comes before me as a request for funding.
You want to modify your motion just a bit?
I will modify it that we need to talk to probably May Hinton about what the direction of the regional mental health board, and disabilities board is doing, but I don't want this to fall off the agenda. Yeah.
Okay. So I think the motion is that the Board of Health is going to encourage the county to apply 988 decals to all county vehicles. There's some question right now that the region may be paying for that. If we hear within 60 days that they are not going to pay for that, then we would go in front of the Board of Supervisors and ask for that. Is that okay?
Yeah.
60 days? Okay.
Well, I'd say 45, but
45 days. I amend that, 45 days. Okay, all those, is there further discussion on this issue? All those in favor of the motion say aye.
Aye.
Those opposed? Hearing none, the motion passes. Thank you, Amy, for advocating that. Next, we have a discussion concerning Public Health Department new staff position. Actually, it's a replacement staff position. We have an open position right now after our assistant resigned a couple months ago. So we have an open position and we're thinking of modifying the job description.
Which isn't, my request is included in the packet.
Okay. And do you want to talk about that a little bit? Or you talked a little bit about it in your report, but do you have
Yes.
anything else you'd like to say?
So again, the direction that I kind of took this go around, I've had a few, from week to week, the needs really seem to vary. One week, I think we need someone who's well versed in finance, and the next it's environmental health. So I've kind of taken a new approach, which is just jotting down the different tasks that I would like to have done within the department, but we just don't have the manpower to get it done. And so then in working with our regional consultant, public health consultant, and kind of reviewing some of the other job descriptions that are out there in public health in some of our neighboring counties, I kind of pulled bits and pieces of this together. I took the approach of first looking at the essential job duties and the like the physical demands and the hours. I did all of that first. And then I tried to look at what term, what title best encompasses these tasks. And that's kind of where I came up with public health assistant. This had been a full-time position. It would remain a full-time position. The pay range, I believe, would need to be discussed with human resource. I think we could look at potentially two different requirements as far as educational background, one being an associate's degree and the other being a bachelor's degree. Of course, depending on which route we were to go would kind of dictate the compensation.
So none have a master's degree.
I don't know that the tasks outlined in here would support needing a master's degree.
So the pay range and requirement or the educational requirements, that's this is a choice that we would make, or are you
Correct.
saying either or for the applicant? You could either be a VA and we pay you this, or you could be an AA and we'll pay you this.
Again, it's something that I would need to work with human resources on. I personally would not disqualify someone with an associate's degree who has years of experience.
So maybe BA preferred, but AA with relevant experience.
With experience, yeah, I think that's a good idea.
Mhm.
And I mean, what you described, Ellie, is I would describe as a generalist, right? You need somebody who can cover a broad range, a broad scope of public health activities, and if needed, more in-depth guidance. That's when you tap into everybody's wisdom or reach out to others to guide further. But no, that makes perfect sense.
I almost wonder if is it an assistant to the director or is it a public health assistant?
That's what I was wondering too.
That's why I like the term generalist. That's what we use sometimes, because then you have actually all included, if you want to put it.
Public health generalist?
Yeah.
Yeah.
I like that idea.
I don't know if it's a term that is already been taken with some stipulations elsewhere, but that's what it is describes for me.
Yeah, I think that's valuable insight. An assistant to the director to me means it would be assisting more me, and I think that there are definitely times when this, depending on the season or the time of the year, that the work may be geared more towards supporting our environmental work or our clerical work. So for that reason, I would be more in favor of public health generalist. But again,
The assistant to the director was confusing.
You can put the assistant to the director under the essential job duties. I mean, then you have it in there as well, spelled out, if that is a concern, I think.
What's that?
Yes, he was. I got it.
It,
didn't
there's
hear
really a
you.
broad range of administrative duties versus other duties. I mean, so it's a very broad, so I like Dr. Schultz's generalist because it is very broad duties.
Is that a public health term though? I mean, it's a hospital term,
Generalist.
generalist, but is it a public health term?
I don't know if it's a public health term. I know that in other job descriptions, I've seen it where you say whatever human resources generalist versus human resources, whatever recruitment specialist also. So
You, Pat, you thought assistant to director would be confusing?
When we had that, because that was the title previously, and I was confusing because does that mean strictly a assistant to Ally, or does it mean like secretarial assistant to the, I thought it was a very confusing
I see,
term as
yeah.
to what her role was.
Have you,
Executive assistant.
Exactly.
and there is already, we have a clerk who could do a lot of the sort of assisting you kind of things, like secretarial things, I guess.
Absolutely.
Yeah. Have you discussed this or shown this to the human resources person?
Not
for the
yet.
county?
Not yet. I did want your eyes on it because I know I've waited month to month, and I think we're at the point where we do need to get somebody hired. And I did not want to get hung up on the description being too general. But I feel like if we could get a consensus on, I mean, I do think the pay range and some of that is gonna be heavily reliant on human resource, but if we could get a consensus among this board as far as the position summary through the end of it, really. Through the end of the proposed description that I have here. Then I could certainly take what's been agreed upon to human resource, and if we needed to make any changes to the title or the pay range or the entry requirements, then we can do that.
Discussion? Is there a motion?
I like generalist better than assistant because I just think that it gets too muddy. It's easily confused. But I didn't know if generalist was a term outside of, is it a term in the public health curriculum that you're using?
We haven't used it much, but I feel like you could apply it to anything.
I'm just thinking, like, that's who we're gonna get, our recent graduates out of university programs. So I don't want them to see that and think, well, I don't qualify for that.
Sure.
Because that's what they look at first is that title, and then they look at the others, so.
And if you look at the definition for generalist, a person competent in different fields or activities, which is,
And we do want them to be competent in different fields and activities, so it does do what we want.
Okay, so. We have something before us. Is there a motion?
I can make a motion.
Okay, is there a second? Second. Okay. Now we'll have further discussion about that. So the salary, if it's $28 an hour, is that around 60,000 a year or just under? Something like that, I think there's 2,040,
2080.
2,080 in a year. And you take that times the hourly rate, so that's 57,000. So that's the upper range you're looking at, or was this just
Yeah,
a,
these are numbers that I had taken from neighboring counties. And again, it's a starting point, I think.
so will that be taken to human resources and you guys will come up with something with her with that, right?
Mhm.
Okay,
So
so,
they already did give a range
Mhm.
back a couple months ago.
Yes, yeah, but I don't know.
for a different kind of job though. Wasn't it?
I feel like it was similar, but I would definitely want to take this back to them and have them look at the different line items and make sure that.
So-
this,
Is the motion sort of like, we like this outline and take it to human resources and bring it back to us, or?
Yes, I think that's a good idea. I would include that in the motion.
Okay,
is this salary, I know some of the duties are different, but is it comparable to the previous position?
I believe the previous position may be a little lower. HR would be able to confirm that, but
I think it was wrongfully low. So. So I think, we need to discuss, I mean, does this kind of cover what we had in mind for our open position in the department?
I mean, I think I'm very comfortable. I mean, Ally's the one that's building the, that she knows where the gaps are. So I think she has the best idea of what she needs or what the department needs.
I agree.
And this is gonna have
Do
to
we-
be very flexible.
Yeah, do we want it though, a bachelor's preferred, but associates okay, or leave it, we have it here on the second page, it's associate's degree or higher.
I would prefer bachelor's degree, prefer myself, but.
Yeah, I would agree.
I know that Sam had her master's and I know it's a different position, but the last time that we interviewed, most of them had master's degrees. So one or two had doctorates, so that's why I'm just saying.
Right.
So I mean, the high level, I mean, you can have you could be a PhD and apply for the job, but the low bottom basement level that we would want, is that a bachelor's degree or an associate's degree? What's the entry level that we want to start with? And I'm thinking bachelor's, but with this pay, I'm not sure about that.
And, I don't know. Like which percentage of it is more. Administrative type things. I mean, I think that's a problem you get to, is if you have somebody with their masters, they might not want to be doing as much as these administrative, taking minutes and these administrative type things. So I think that's kind of
I think that's something you can discuss with HR too, they might be
Yeah.
able to.
I mean, I think
Guide you.
the other way you could say it is like preferred bachelor, but so affiliate, was it associate's degree with so and so many years of practice and experience in public health can be considered equivalent. I don't know how you phrase it best.
Okay, so, any further discussion? Hearing none, let's take a vote. All those in favor of the motion to have this, job description reviewed by HR and then brought back to us? say aye.
Aye.
Aye. All those opposed? Okay, motion passes. So unfortunately, one more step.
Yep.
If you happen to get it in a final form, we'll call a special meeting, because we need to get this listed. So if you do get it in special or in final form, and then I think we could have a special meeting and act on it so we can get this job advertised. It's just my opinion. Okay,
Thank you.
all right, very good. Next, we have, D, DNA contract addendum, and I believe we've already taken care of that, or
Yep, do you want me to do it?
you could just, give us a summary.
Sure. We had signed our community health nursing contract back in January. And at that time, we only had projected grant awards. And so we did not have what was fully awarded. And as you can see, several of our grants had some changes. I brought up at the last month that our Wise Women program will no longer be. So that's where you see that $15,450 difference. Tobacco prevention and control, we received an additional $311. And unfortunately, we received a cut in public health services by $1,842. So this is just correcting the amounts that are within our contracts.
And I've signed it, so it's in the record now.
Thank you.
And then our next item will be E, Dubuque County Public Health Department name and logo revision. The only question I have about this is there anything that we're not thinking of if we change our name? Is there gonna be a lot of, I don't know, ordinances in the county, or I don't know, policies that have our old name in it that are gonna then have to be changed?
I don't know what the formal name was before. Was it Dubuque County Health?
I think it was Dubuque County Health Department.
Okay,
I think that's what it's
okay.
been.
Well, then I do think that that's a very valid question.
Mhm. There may be some administrative work to do on that, so that's something to keep in mind.
Right.
And that'd probably be a question for the auditor. He doesn't look like he's on anymore.
How are you legally licensed or have an EIN
Yeah.
or whatever it is gonna be?
So I think I would maybe just
Good thought.
for action purposes, maybe hold off on that until we do a little bit more research
Okay,
on that issue, but the logo, I think
Logo.
we could talk about.
okay, perfect.
You might also be able to do it through the business has for the
Right.
change, where you keep it illegal.
Right.
Yeah.
Yeah.
An additional way to describe yourself.
Yeah.
So as far as the logo, I mean, the logo that we use currently is just the Dubuque County logo with the words prevent,
Protect and promote.
promote, the 3 Ps around it, so. How does everyone feel about changing the logo?
I think we should have a logo that is ours, especially if we're going to sponsor things like with the VNA and have both of those. It needs to be so people can say, I know exactly what that means. And right now, I don't think we have that.
And I think, Ellie, if I recall correctly, this logo is sort of a general public health logo that is used in many other departments as well. So it is sort of in sync, like the Red Cross is used for other parts in healthcare. So I think that would make sense for me to use that particular logo with that kind of text setting that you had proposed. I remember in Iowa City, I think they had the same logo in the Department of Public Health.
Thank you.
All right, does anyone want to make a motion concerning the logo?
I can make a motion to adopt the logo as proposed.
Thank you, Hendrik.
I'll
Second.
second.
Okay.
Adam, second.
It's been moved and seconded that we adopt,
Second twice.
we adopt the public health logo for our Dubuque County Department of Health, Public Health. Is there any further discussion? Hearing none, all those in favor of adopting the public health logo for the department, say aye.
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 All those opposed? Hearing no opposition, then that motion passes and we will adopt that logo. And we'll continue working on the name. Okay. Okay, and the last item we have, Board of Health opioid subcommittee recommendations. So the subcommittee met yesterday with several people from the community. And the subcommittee is a subcommittee of the Board of Health. And anybody that's on the Board of Health can be on the subcommittee. So just whoever can show up can be on the committee. I think there were 3 people there, 3 board members there yesterday. And so there was a really robust discussion, I think, and you know, several entities had some ideas, but the committee, after hearing from everyone, came up with a recommendation. And there were 4 items in this recommendation for the total board to consider. And I'll just name those. Number 1 would be procuring funds for a project manager or something like that to assist with this opioid settlement. Next is mapping and/or needs assessment around this issue. Next is to utilize the opioid resource network that gave a presentation yesterday, and some of you have already heard their presentation. And then 4th, decrease barriers to Narcan access. So I think the Board of Health wants to be involved, and the Board of Supervisors were all at the meeting yesterday, and they kind of want a framework and how is this all going to work? And they were happy, they seemed happy with the results of the committee. I don't know how it's all going to work, but I think number 1 step is, and the supervisors said this too, our department cannot handle this under the present situation. So we would need to hire somebody to assist. And in order to do that, we'd have to have permission from the Board of Supervisors, of course. So theoretically, some of the money from the settlement could be used for this position. So that's one thing that was talked about. And I think Ally, and we all know this, we can't do this unless we have somebody. Ally can't do it. And there's nobody else in the department. So. And then number 2, the mapping and the needs assessment, the city Department of Health, Mary Rose Corrigan said that she could help with that. But she could help with it, which means that somebody else has to do the other half of it.
But it seems like a project manager could do that.
Yeah, I think it could. I think so. And then utilizing the opioid resource network, that's free. And they've just got, it's regional. She covers several states in the Midwest. And she just has a wealth of knowledge. And so I think even at our next committee meeting, maybe we should invite her to, but we can talk about that. So utilizing that, that's kind of a no-brainer. And then decreasing the barriers to Narcan access. I don't know enough information about the present situation to know how we can decrease the barriers. So that's something, again, a project manager or somebody could do the legwork on so that we could develop something. So the next step is really, we have absolutely no authority or anything to do anything. We would have to go in front of the Board of Supervisors, I think, to ask for the funds for the project manager. And so I think that's our first step.
Yeah, so you need to write up a proposal, I think, or someone needs to write up a proposal.
And someone would need to develop that proposal before they could write it up, so.
Right. Are you looking at me to do that?
No, I'm just.
I mean, I can,
No,
but-
no, I'm just saying, it's a big project, and we personally, in this group of volunteers, who most of you have full-time jobs, we can't do this. It's not for us to do, and Ally can't do it, so I don't even know how to get a proposal written up, but maybe we can meet and work on that. But we scheduled another committee meeting for a month from yesterday, so it'll be the day before our regular meeting. So we'd like to have something.
Clarification question, just that I understand it the right way. And I think Ann McDonough also wanted to ask something or say something. what is the time frame that we think this money will flow into the county? Is this like a one-time sum that we will get? Will it be over a couple of years? I'm not sure I recall
Yeah,
that.
there's already $539,000 that is dropped for this, fiscal year 23, 24.
Okay.
And then there's a schedule to your question, Schultz, that on average will then dole out $100,000 on average per year all the way through 2039. So
Okay.
this was a rather, lengthy part of the discussion that Kevin Dragato had brought a table with those figures to the meeting because he had at another time talked about the use of the money for an endowment. And so we got into discussions about what ultimately was, do you spend part or all of it now, or is there another alternative, which could be creating an endowment? And the discussion even went as far as to say, county or state funding could, front load that, provided they had the capital available so that the endowment could start, you'd have $2.5 million thereabout in an endowment if it could be front loaded. And then when those $100,000 per year through 2039 started to come in, that would just be money that was paid back to whoever had helped to seed the endowment to begin with. And then rough figures of 5% interest off of, the endowed funds would generate, $100,000, was kind of the target, but in perpetuity, with the idea that at any time or by a schedule, you could reevaluate whether or not you wanted to continue $100,000 a year if that plan seemed to work, or liquidate part or all of the endowment for, strategic or situational purposes. I'm summarizing what was a pretty robust discussion, but I think it captures your question.
Okay, the briefness.
So,
The reason
yeah, go ahead.
Sorry, the reason I'm asking is, if you bring up a project manager, these are usually temporary positions where you say, in order to get something up and running and in structure, that's when they come in and do it. And then actually somebody else takes over and runs the program or the project as it is intended to do. So this is not a permanent kind of expense from that funding that will be received. I think if it's front loaded, I think it would be a good investment to have somebody who has a structured approach to implement a project and some, how can I say this best? Helps to implement something that will keep on giving to address the opioid pandemic for a long time in the right way with the right people and the right structure. I would not be an expert in this, and I don't know if anybody feels that they have the expertise, but usually they're pretty good in writing it up, structuring it, and then handing it off once it's running. So I think the investment, from my perspective, to make a long story short, into a project manager with that amount of money over that amount of time is probably a reasonable one in my books. And if we limit it for time frame until we have something running as part of our proposal.
I think just to add, and I know Ann can add to this because I believe, the idea originated with Ann around a commitment to a position or a person or a coordinator. And at the heart of that, I believe, was the idea, as Sandra has communicated, Ally doesn't have the bandwidth to add this to her job duties. And the board is a board of volunteers. And then even as we looked at the folks around the subcommittee meeting yesterday, in a similar way, the question, that begs an answer is, but who's going to take charge, right? Who's going to drive this? Who's going to be in charge and own it, as opposed to a bunch of people that are committed to it until either a problem arises, they don't have the time, this isn't my full-time job, I'm a volunteer, whatever those things may be. So I think that was the premise, and I'll probably shut up and let Ann, probably will offer more light on what she she had shared yesterday.
And we see your hand is raised.
Yes, thank you. I think, Mike, I appreciate your introduction. So this funding is going to go to 2039. Dubuque County has never been involved in substance misuse, ever. We pay some bills for overage for people who are committed. That's it. This county has no residential treatment program. This county has no detox program other than what's in the hospital if you can afford it. There's nothing. It is dry earth. And this is an opportunity for the health department to step into an area of public health where most other counties have staff. This position will fund a staff position ongoing through 2039 at least, and that position can be a grant writing position. More than half of the money coming from the opioid settlement to Iowa, more than half of the money is to the state of Iowa itself, the government of the state of Iowa. Then the additional 50% is divvied out between the counties by population. There is an incredibly large, multiple millions of dollars sitting in Des Moines with which we could partner, right? There might even be an opportunity for this position to be partially grant funded by the Iowa Department of Public Health once we figure out who's in charge of administrating their funds. So it is an amazing opportunity, but I agree with what Hendrik is saying. This shouldn't be a project manager that then hands it off. Hands it off to whom? This is not a therapist. This is a person who's going to understand substance misuse. They're going to understand that industry, and they will lead the mapping. They can coordinate needs assessment. And I mean, that's the person who's going to bring forward, I think, to you projects that are going to need to be evaluated. But I do think it's an opportunity for us to change for our citizens, potentially forever, what's needed. How will we ever get detox or residential treatment on this issue if we don't start with the basic framework? And I think that could be done by somebody who's new to your department. You know, I don't know where you are with strategic planning, but I know each of you individually, and I know this is a high priority for you as individuals, to be discussing not just opioid misuse, but all substances. Meanwhile, the East Central region for brain health, every year we bring this forward as brain health to say that we need to be able to coordinate our tax dollars between brain health and mental health services and substance use disorder. Right now in Iowa, that's a very artificial line that is drawn. So this gives us the opportunity to use funding to do work that we've otherwise been prohibited from doing. So I would encourage you, and in terms of who can draft this, Chelsea can draft this. She probably has 6 on file already. Our HR director does this work well. She can draft what you need. I'm happy to work with her and to bring back to you different variations of what it might be. But I don't think anybody at this table as a volunteer needs to draft anything. I think Chelsea's background lends her to doing this. She has healthcare background. She can do this easily, I think.
Great, great information, Supervisor McDonough. Thank you. Oh. Is there a motion?
Summarize what the motion would look like again, just that.
Four points, right? It's just bringing the recommendation from yesterday to move forward, right?
I think just to put one part of it right now, funds, getting the position.
The position.
Yeah. So the motion would be, I think, endorsing hiring a project manager or some type of employee to assist us with this, the opioid settlement funds.
I would do it broader than that, and
Okay.
I would say behavioral health, but that's just me.
I would do it even broader and keep it vague and let you know, an HR expert, as described by Ann, you know, take a whack at a formal title, but I would say, you know, something along the lines of a opioid settlement subject matter expert, right? I mean, that's what we're effectively looking for, is somebody who has the subject matter expertise to guide and drive these
Yeah.
solutions and to own it, right? To, they're
Yep.
gonna be the ones that you're gonna identify with, finding the solutions by creating collaborations and networking existing services and getting the people that need to have a voice in it to the table or getting their perspective to the table.
I like that, opioid settlement subject matter specialist.
With project
Yeah.
management skills.
What?
It's definitely a specialist.
And
Hendrik, are you saying something and we're missing you?
No, I just said, you said opioid, whatever settlement, behavioral health,
subject matter
mental health,
specialist.
subject matter specialist with project management skills or experience. I think something in that realm. I mean, we can design that position. That's the beauty of it if we propose it. I like the idea that Amy and you, Mike, brought up, like just focusing on the expertise, because you need that too. Otherwise, you don't know where to look. I agree.
We could also ask the opioid response network. They probably have drafts of this, and I just would caution that we have to have it be related to opioids prevention. Otherwise, it won't be able to be inside of the federal funding. So we can't use this funding. There's a clawback provision, right? So we want to make sure that if we use the opioid response network as a resource, which they have lots that they've shared already, we're going to be well within. I mean, the idea of hiring somebody came from that meeting, Ally, that we were at. And she said, I don't know why you don't do that. You should get somebody on the ground doing this work right away.
Okay, so we do have a motion that we are going to make a proposal to hire a staff person for the Department of Health that will be in charge of the opioid settlement funds response.
I'll make that motion.
Okay, any second,
Second.
any further discussion?
I think rely on the experts to hammer it out because they will be able to guide you much better than we can.
And the board, do you want to see it again before?
Yeah, I think we should see it again.
Okay. All right, very good. All those in favor of the motion, say aye. Aye. Those opposed? Okay, so, we'll work on that.
If I might, and I know I'm interrupting from the black box, but Sandra, to the chair, we need to craft, I would strongly suggest that you craft each of these positions. You're asking for 2 positions. One you've accidentally described as new staff person. The Board of Supervisors is not going to favor 2 new positions. They just aren't. I know my colleagues well enough that they're going to go, what are you talking about? You need to be able to articulate that one is the hiring of the assistant position that remains open, and that even that person won't be capable of doing this opioid work, right? Otherwise, you're going to end up swamping whoever you're going to hire. So I would just say being very careful and strategic about that so that it's not misunderstood. The work that's being presented to you it's rapidly expanding, right? So anyway, those are my thoughts to try to move it through the supervisors.
We don't have to take the assistant to the supervisors though, do we? We didn't the last time.
Changes
The
in-
generalist.
Changes in job description, you mean? That doesn't have to go in front of the supervisors, does it, Ann? If we change a job description?
I don't think that's necessary, but for any increase in funding and ultimately for any spending of those opioid funds, that is required to be approved by the supervisors.
Oh, yeah, right. Okay, very good. And then the rest of the recommendation from the committee, the mapping and needs, utilizing ORN and decreased barriers to Narcan access, we will keep those on board. But honestly, we can't do anything on them until we have somebody to assist us, so. Okay, great. The next thing on the agenda, let's see. response to public questions and what?
Yeah, we did. Yeah, you said, yeah, you said aye. I haven't heard it made tonight. Waiting for one.
Yeah. No. Exciting.
I guess there was a request by Applewell and Pump to conduct on-site nitrate testing. You want to just give a little,
Yeah, yep, so I can talk briefly to that. We do a lot of water testing for Apple, Well, and Pump, and we do the bacteria testing in our lab. We currently send the nitrate testing to the state hygienic lab. Not many counties do on-site nitrate testing. Now, I'm not saying that I'm opposed to the idea, but definitely would need some time to do a cost benefit analysis, which would mean looking at how many nitrate tests we've performed in the past year, what the expense of outsourcing them is, and then what the expense to keep them in-house would be. But I did want to acknowledge formally that they had made that request and that we're looking into it.
What's approximately the turnaround time on the nitrate test? When you ship out, like, is this slowing them down? Is that why?
Yes, yeah, I think it's 7 to 10 business
Okay.
days.
and that's the reasons for their request. The speed, you think, or what?
Yes, I believe so.
All right, so you'll respond to them, Ellie, or you have already?
I have not, I will, when we do the analysis.
Okay, then unfinished business, the letter to the county attorney, we just attached it to the packet as well as his response. And it is what it is. And then B, enforcement procedure updates. You can tell from the letter from the attorney, I don't have any enforcement procedure update. We're on our own with that. So if we want to do something with that, I think we have to request. We can't get help from the county attorney, it doesn't look like. So if we can't, then we could ask him if it's okay with him if we hire an outside attorney to help us with that. So we could do that. That's something that's being thought about. New business, there's no new business listed. The board communication and reports from other board members. Is there a chance to communicate with the rest of the board? If you have anything you'd like to say. You want to start, Amy?
Yeah, I just went to, well, I've been to several meetings, but the latest one was the Dubuque Wellness Coalition, Dubuque County Wellness Coalition. And I think that was we met at Pizza Ranch, and it was a social because we don't usually meet in July. And so we had fun. We had a game of acronyms. So when you said BCC, I'm still thinking, because that was one of the things. CBC was one of them. Alexis and I don't remember the other girl's name, Olivia maybe, wrote the game, and it was fun. And we had a fun time. And you can eat healthy at the Dubuque Pizza Ranch. I sat right next to the Hy-Vee dietitian or nutritionist. And she had a very lovely salad. And but it was good. It was really fun. And it was really nice to just have a relaxed, just casual meeting and not just boxes on screens or half boxes and half live people. So it was nice. And then I was at a maternal health meeting, and it was fabulous. We had Laura, I think, from the VNA do breastfeeding presentation, and it was fantastic. And there are a lot of doulas on that call now too. So I can see how it's really increasing. It's really exciting, actually.
I'm excited too. And Laura couldn't have been a more perfect speaker.
She was fantastic.
She really knows her stuff when it comes to breastfeeding. So she worked at Finley and was part of the reason they had Sweet Beginnings and did the home visits, and the home board had a big part in that.
Mhm. Well, it made me want to have another baby, but but not really, but so go for it. Go for it. There's so much cool stuff out there now and so much cool knowledge, but no, they were very good. Oh, and one thing, this is really cool. Remember back in, I think it was May, when I helped with the cleanup at Burden Park.
Yeah.
Well, that group, it was IJAG, which is Junior Achievement. They reached out to Vicky. The VNA and other organizations are going to be at the fair next week. they reached out, they want to help staff the booth.
Oh, is that
Because of
fun?
that relationship that was
Wow.
created through, I think that was through DASAC, Gary Substance Abuse Coalition. So anyway, kudos again to Vicki for building those connections.
Yes. It's definitely helpful. Fair Week is really tight in our office, trying to staff the booths out there, which is wonderful that we're able to do that. I'll actually be there on Friday night, staffing it myself, so.
Oh, Friday night.
Yeah, Friday night is my shift.
I was thinking of coming the free day, which is Wednesday.
Wednesday, yeah.
And they have Neil Diamond and Johnny Cash that night, so can't beat that. Okay, let's see, anything, Patricia, anything, Adam? Mike? I think that's it. Very good. Hendrik, anything?
Nope, all good.
Nope. All right, thank you. All right, let's see. Our next regularly scheduled meeting is August 16th, 2023 at 4:30. The opioid settlement funds subcommittee will meet on August 15th at 2:00. And public comment at this time, anyone may address the board on matters of which are concerned to that person, which are not agenda items. Please raise your hand if you're on Zoom, or if you're here in the room, please stand up, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks will be limited to 3 minutes. Would anyone like to speak? We have a speaker tonight. Yay.
For those of you that don't know me, I'm Diane Pate Freiberger. I live on Middle Road in unincorporated Dubuque County. And I just wanted to speak to a comment that was made regarding the COVID after action report. And that was, that there was no one for the Board of Health that that spoke, or that was the lead person for the COVID response. And that is because when we spoke, we were told the incident management team was going to handle it. It didn't stop me from speaking, and I actually have lots of emails and lots of voicemails related to it. I continued to push, okay? But we were still told that it was the incident management team that was supposed to deal with that. So that's just a word of caution to you. If you want a voice, if a pandemic happens again, or a response happens in Dubuque County, have it said ahead of time that you will have a voice in the incident management team, if you want to have that. Okay, thank you.
The Board of Health, or you mean the Department of Health?
That the Board of Health, that the Board of Health did not have someone, it's line 21 or something like that,
No, I mean,
that you would have a voice to someone or to the full incident management team.
like, there would be a Board of Health member on the IMT.
No, that you would have a voice to them,
Okay. All right,
that
Thank
your
you, Diane.
voice would be respected. How about that?
okay. Good point.
Yeah.
Yeah, I would just like to, Diane, I did not know you were in the room, and Diane Pate Freiberger is another one of those folks that I have eternal gratitude to as well. She spoke so hard, so long. My colleagues didn't put her on the Board of Health again. So Diane, I know that that's not something you wanted to have happen, but you were in the streets, you were advocating for public health. And I'm sure you felt alone at times, but you were an amazing advocate, and you don't let up. You're in the room again, even tonight. So thank you for being persistent. And I don't disagree with your assessment about this Board of Health that sits around the table right now would have a voice, I believe, Diane.
Thank you. Thank you, Diane. All right. Is there a motion to adjourn? A motion to adjourn.
Good motion.
Very good. All those in favor say aye.
Aye.
Aye. Motion carries.
Thanks, guys.
I'm still sitting here in an hour.
I'm wondering what happened. 'cause these
You just voted, Adam.